So I'm going to focus on that today. But you guys are going to be speaking. So this is how it's going to work. If I say your name today, guys, if I say your name, you can answer here. So this is really important. All right. If I say your name, you answer here, and basically I'll ask you questions. So for example, if I say Nana, Nana's going to put on the microphone. Can you say hello, Nana?
Hello.
There we go. Easy. Now, sometimes I might say everyone. So you three, if I say everyone, of course that means everyone can speak. But the main thing is try not to talk over each other. If Nana is speaking, just don't interrupt that person, okay? Finally, if you have a problem and if you cannot speak, just let me know in the chat. So I think you guys are okay, but if you need to go or something like that, you can just tell me in the chat later, okay? Now, today's class, guys, we'll start the class now, and I will record the class. So if you want a copy of this on video, if you want a video copy, send me a message at the end of this class, okay? Let's start. Okay, so this is the OET demo class, and we're going to talk about speaking today. So how to introduce yourself will be the main topic. And I want, maybe we can start with the doctor here. So is it Selena? Can you say hello?
Hello,
Am I pronouncing your name correctly? Celine or Selena?
Selena.
Selena. Okay.
Yes.
So OET speaking, how do we introduce ourselves? Like,
Hi.
what's your opinion? Oh, yeah, you can give me an example. Go on.
Yes, hi, I'm Selena. I'm from Bangladesh, is the city of Dhaka, and I'm a MBBS doctor from there.
Mhm.
And I completed my degree in 2009.
Okay.
And as a doctor, I want to, um,
Go on. No, this is really good. Now, let me stop you. This is an introduction like for a colleague, professional friends, Selena, okay? It's actually a very, very nice introduction. I can tell you're very high level, okay? But what I mean is in OET. So I should have been more clear, Selena. How do you introduce yourself to a patient, right?
yeah.
So what kind of things do I need to say? You know what I mean?
Yes, first introduce my name. Then after that, which GP or where I'm working
So
as a GP
your name
uh,
and your profession. I think that's
and
good.
profession, and what I should do with the patient is like a is
Yeah. What you can do. Yeah, things you can do. Definitely. Let's just focus on this name and profession. Also, do you need to say hello, Selena?
yes, greeting first,
So
obviously, yes.
let's just have I know we'll start simple and then slowly it will get more and more complicated. Okay. So starting simple. Um, give us an example. Give me hello. Tell me your
Hello.
name and then tell me your profession. Three, two, one, go.
Hello, I'm Selena. I'm a doctor for you today. And could you please tell me your name?
Okay. Now, Nana, do you think this is okay? What she just did there? Laboni as well? Is it okay? Hello, I'm.
I would like to add hello, good morning, or good afternoon.
Yeah, you can do it. It's not really an issue. You can do it if you want.
And then my
She
name
said, I'm
and
your doctor for today. Your doctor for today. Is that okay?
yeah,
If I'm a nurse, can I say I'm your nurse for today? Yeah.
yes.
I think this is more or less okay. I like this. We have a nice, easy start, right? So, hello, I'm Alan. I'm your teacher for today. This is a very nice, very clear. Now, what about Nana? What do I need to do next, though? I cannot stop here. What am I doing next? We can have Nana, Laboni as well. What about
How are you feeling today?
you can ask them a question. You can ask them, how are you feeling today? Do you agree with this? Oksana, Selena, is this correct? How are you feeling today?
Uh, I would prefer that if I introduce myself and greeting finish, then I would like to ask, could you please confirm your name?
Yeah, I agree. So, Laboni, don't you think we should check their name first?
Yes.
Okay, so Laboni, what do I say if I want to check their name? What do I say? Like,
Uh,
so let me
may
help
I
you.
may I know your name, please?
May I know your name? Now, does that sound right to you? Selena, is that right? May I know your name, please?
Actually, when the patient coming, I know their name, so that's
Yeah.
why I just prefer to confirm that. Could you please confirm your name and date of birth? That is important to see that patient to that is the he or she is the right person in front of me.
Yeah, it sounds a little bit better like this, Laboni. Whether you're a doctor or a nurse, it doesn't matter. This verb confirm, okay, Laboni? It's like saying,
Yeah.
I already know your name. I have it on my notes, but I want to check, right? So it just sounds a bit more appropriate, a little bit more professional in this context. Your question, perfectly fine, but this one is better. It sounds better. Okay, but Nana, can you say hello? Or Oksana?
Hello.
If the person says John Smith 88, what do you say next? What's next? Do you say, okay, bye? Is that what we say? Have a nice day. No, we need to say something else. What do we need to say next? Something else.
Next,
Can
I
I? Well, let me give you guys a
How
clue.
can I help you?
You're going to say, great. Can I? Okay. In in the UK, in Australia, in the West, and probably in almost in many countries, the first name is not a name that you can use without asking permission. It's very polite to ask for permission to use the name. So, Selena, how can I ask for permission here? Can I?
Ma May can you, Alan?
Well, may I can you?
Call you. Yeah.
May I call you? You can say may or yeah, may I call you is okay. Or you can say, can I call you as well? There's nothing wrong with can. It's perfectly polite. Okay, so can I call you John? We're asking for permission to use the name. Okay. If they say yes, Oksana, are you there? Normally you can speak, Oksana.
Yeah. Yes, I hear.
What's next?
Next, you need to say, great, nice to meet you, Alan or John.
Well, I already said great here. Okay, I can say okay here.
Or
And
thank
just
you.
say great here. Great. Nice to meet you. Is that the idea? Nice to meet you.
Yeah,
or
nice to
pleasure to meet you.
Okay, that's fine. Guys, I think this is good. So the checking phase, this phase here, you need to actually ask two questions, not one. Okay. This one is very simple. We had a very nice example from Selena. Then we've got this idea of asking a question as well. But is there anything else we can do before we ask this question? Any ideas of what we can do before we ask this question? Someone?
Greeting, name, confirm their
Mhm.
name, and then after that, why they are came for doctor appointment. That's why you can ask. That
Yeah.
is the what is the issue they are came here, or what
Well,
is the
yes. But I don't want to say why they came there. That sounds strange because it's not always
sorry.
going to be It's not always going to be a clear reason. Let's just call it, you are right, Selena, but let's just call this, guys, situation phrase.
Yes,
Okay?
situation.
And you can say something like this: I am aware that. Just very simple. What does aware mean, guys? I am aware that. I, what? I hate, I love, I know. What does it mean, aware?
No.
I know that.
It's the same as saying I know that. Okay,
Yes, I know that.
you can just say I know that or I'm aware that, and then you're going to say the thing. So you might say I'm aware that you are having problems with medication, right? So I'm giving this context. I'm telling them that, yeah, I know the situation already. Now, this can be very, very useful in OET in this exam. Sometimes just telling the patient that you know already is really good. Okay. Now, if I say this one, if I say this, I can also say this. So, what does so mean? Oksana, Nana, what does so mean? Anyone, what does it mean when we say, so how are you feeling?
Just carry on our conversation, that is.
Sometimes it can be like, I want to carry on, true. But if I say to you, Selena, I'm aware that you're having problems with your medication. So how are you feeling today? What does it mean in that sentence?
That means he'll elaborate his condition or the patient condition, what is the
Yeah.
going on in this moment.
We are asking for feelings about the problem, right?
Yes,
And
problem.
this can be very, very useful in OET because you don't really want to talk about other problems, do you? Right, guys? You don't want to talk about John Smith's problems with his business. I mean, it will be nice to talk about his life or other problems, but really you have a job and you probably don't have a lot of time
But
in
there is a time limit, so
more than that in the exam as well. So this allows, guys, this allows us to focus. We've focused this question on this problem. Okay, so I'm going to give an example now. Jafet, could you be my patient? Or Laboni, could you be my patient?
Okay.
You can say any name. You don't have to give your real name. You can just say anything, okay? In fact, Laboni, you can just read here. Just read, okay? Jane. You are
Okay.
Jane Smith, okay?
Okay. Okay.
All right, guys, listen to this. 3, 2, 1. Hello, I'm Alan, and I'm your doctor for today. Could you please confirm your name and date of birth?
Hello, I'm Jane Smith and I'm 88.
You don't sound 88. Okay, can I call you Jane?
Yeah, sure, you can.
Okay, great. Nice to meet you.
Nice to
I'm
meet you
aware
too.
that you're having problems with your medication at the moment, Jane. So how are you feeling today?
I'm not feeling well. I'm feeling dizzy and nausea, those kind of things going on with me with this medication.
When did it start?
Um, a week ago.
Okay, stop there. Thank you. Now, I made a mistake. Did anyone notice the mistake that I made? Made a kind of, in OET, it would be a little bit big mistake, a little bit of a big mistake, if that even makes sense to say that phrase. A medium-sized
When I start, I think I should say when does it start? When does it start?
Well, it is singular. Should I use does for singular? Or one?
no.
Does is for
For third
no, wait
person.
a second. It is does it she does is for singular. It does
Yeah.
when we say when did it start actually? Why do we say when does it start? We say did.
Yeah, I did, yeah,
But
because it in the past.
you would say she. Ah, yeah, because it's past, of course. You're confusing me here. So when does it start? That sounds very strange. That's what's this. Look, are you asking about the past or a regular action or the future?
Yeah, for the past, because the complaint is already happened.
So this is wrong, right? I can say, oh, I'm very excited about the cinema tomorrow. When does it start? That's a question about the future. Okay. We need to say, when did it start? But that's not the problem. The problem is, should I immediately ask a question like this after the patient said they felt bad? Think about it.
I should,
Is my patient feeling good?
no,
So what do I
uh,
do? I just ask questions? What do we
no,
do?
I need to show my response. I really sorry to hear that.
Yes, empathy. I'm really sorry to hear that. So that was my mistake, right? I just asked a closed question immediately. Instead, I need to be actually giving some empathy. So, for example, Selena, what is a good empathy phrase we can use? What can we say? I'm sorry
I'm
to,
sorry to hear that.
or we could say,
That
that must be anyone? That must be
Uncomfortable.
uncomfortable, hard, stressful, difficult.
Mhm.
You can just put, guys, you can just add your adjective in, okay? So you can choose here your own adjective. Okay, so look, we have now an introduction. In a specific situation, we can use, this is a very nice introduction now. And I would like Selena to try this. Can you do all of this with me, Selena?
yeah.
I am your patient. And can you you can read if you want, or
Okay.
you can change it. But if you change it, don't make mistakes because I will tell you. Okay?
Okay.
Maybe you can just read if you prefer. All right? Guys,
Okay.
listen to this. 3, 2, 1, go.
Hello, I'm Selena and I'm your doctor today. Could you please confirm your date of birth and your name?
Yes, it's John Smith, 88.
Can I call Smith?
Yes, you can call me Mr. Smith.
Great. Nice to meet you. Hi. Um what is the sorry. Okay. Situation. Okay.
I am aware that. It's okay. No, it's okay.
I'm aware that you are having problem with medication.
Mm-hmm.
So, how are you feeling today?
Oh, I'm feeling really bad. Awful.
Oh,
I'm feeling really bad, doctor. Really, really bad.
oh, sorry to hear that. And
Okay, stop there. Stop there. Okay. Now, guys, this is Selena's very good. She just this is the first time I asked her to do this. So she's just a little hesitating. But Selena, it's just because this is the first time, okay? I think you're a very, very good speaker. Don't hesitate though, right? You just straight through. Don't stop, okay? Um, One small mistake she made, not the hesitations, because she's actually very fluent. What was the mistake she made with the name? Did anyone notice the mistake with the name? Can I call you?
John, because of the Smith is the surname. I use the
Yeah.
surname. Yes, because I'm is nervous the first
It's
time.
okay.
That's
Yeah.
why.
But it's an interesting mistake because guys, you don't need to ask permission to use the surname, okay? So you can say Mr. Smith, right? You don't need to say, is it okay if I call you Mr. Smith? Because there's no other name he can use. But the first name we ask for permission, and I know she knows this, okay? So, but we had the first practice.
May I ask one question?
Yes.
During test, if I saw the name is John Smith, but if I start my conversation start with Mr. Smith, yeah, they will confirm me the name, and instead of asking, can I call you, asking
Yeah.
them permission, I can tell, hello, Mr. Smith.
You can do that. You can. Now, also, you can, guys, here you can say, for example, like, so what brings you here today? Okay. But the reason why I don't teach that is because in OET, you are graded on your relationship building and your empathy. So what is empathy, guys? Nana, Oksana, what does that mean, empathy? So in OET,
Empathy, maybe it's a respect for patient.
yeah, respect. What else? What is empathy? Like specifically, it's not really respect, although that is like very strongly connected to empathy. You know, if you empathize,
Understanding patient's condition.
showing understanding, showing you understand, yeah, showing you care, showing you care,
I understand the patient feeling.
sharing feelings, understanding feelings. Okay, so this is called empathy. Okay, it's inside the criteria for what's called relationship building. There's many different points, but one of them is this idea of empathy. Okay, so we need to show understand, show we care, and show we're sharing feelings. Well, we're doing that here, right? But we're also doing it here. How are you feeling today? That's an empathetic question. We're also kind of doing it here, Laboni. To use the first name is very empathetic. Does that make sense? If I just
Yeah.
if I just say Mr. Smith, Mr. Smith, that doesn't sound like I really, it gives the feeling of very professional, but very distanced as well. If you're using the first name, it sounds like that you understand them, you know they're a human being, you're speaking to them in a very empathetic way. Does that make sense? So you don't have to do it. It's not necessary, Laboni, but I think you can increase your score, right?
Okay.
Now,
Mm-hmm.
guys, this is SET is a school and we teach exams. We teach you to pass the exam. All right. Does anyone else have any other questions like that? That's a very good question. Anyone else want to ask me a question? And microphone off, please, now, Laboni. Anyone else would like to ask me anything like that? Okay. Well, I want someone else. Oksana, can you be my doctor and I'll be your patient?
Yes, of course.
Okay, everyone, I want you to listen now. Okay. What are we listening for? Everyone, what are we listening for? Errors. More specifically, what are we listening for? Come on, guys, what are we listening for? We want to have good pronunciation. Okay, what is pronunciation, everyone? Pronunciation. Everyone, what does it mean?
How you speak.
How you speak.
Correct.
We
Correct.
want good fluency as well from Oksana. What does fluency mean?
Fluency is correct and speak not fast and without mistake.
Without stopping. Okay, so without stopping. So, for example, in Selena, a little bit of fluency issues, but that was only because she was for the first time trying it. Okay, so guys, I want you all to listen to it for pronunciation, for fluency, and for any grammar errors. If you hear any grammar errors or any other errors, okay, with like with the name or something like this. Okay, so Oksana, are you ready?
Yes.
Class, are you guys ready? This is what you're doing, listening. 3, 2, 1, go, Oksana.
Hello, I am Oksana and I am your doctor for today.
Mhm.
Could you please confirm your name and date of birth?
Yes, it's John Smith, 88.
Okay, can I call you John?
Yeah.
Great, nice to meet you. I am aware that you are having problem with medication.
This is not a question, Oksana. Don't stop. Don't stop.
Okay. So how are you feeling today?
Oh, I'm feeling terrible. Terrible.
So sorry to hear that.
Okay.
What happened with you?
All right. What do we think, guys? Pronunciation? Did everyone understand what she said? Every word? Thought it was very good. I didn't hear any words difficult. Totally fine. Was the fluency okay, everyone?
A little bit.
Fluency needs to be improved.
Well, only because she was stopping here.
Yes,
Yeah.
So,
the
yeah,
same.
this is important though. We can all learn from this. These two are together. Don't stop. Oksana, it's like this.
Yeah.
I'm aware that you love to eat pizza. So how are you feeling today?
I am good.
Maybe she's eating pizza right now, right?
Yeah.
It's one thing. I'm kind of controlling how you answer. It's a way to focus and control the answer. Because if I say I am aware pizza, you must now tell me about your feelings for pizza. Make sense? So don't stop for this. Some fluency, apart from that, though, I thought it was very nice. Your fluency, apart from that, was, let's say, okay. I'll give you sort of average fluency. Grammar errors. Any grammar errors, guys? No, I don't think so. Did anyone hear any problems? Thought it was very nice. Any other errors? Did she make a mistake with the name? Did she do anything? No, I think it was fine.
No.
So basically, look, you just need to, Oksana, just repeat this a few times.
Yeah.
Take a photo, repeat it. Repeat, 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 and then it becomes automatic, and then you can just do it very easily, very quickly. This is just starting the OET test, okay? All right, I want someone else now. Who else would like to do some speaking? We've had Selena, we've had Oksana. Laboni, do you want to try?
Yep.
Okay, 3, 2, 1, go.
Hello, I'm Laboni and I'm your nurse for today. Could you please confirm your name and date of birth, please?
Yes, it's John,
And how old are you, please?
88.
Okay, thank you. Can I call you John?
Yeah, that's fine.
Okay, great. Nice to meet you, John. I'm aware that you are having some issues with your medication. How are you feeling today?
Oh, I'm feeling really bad today.
Sorry to hear that.
Okay, thank you. What do we, Laboni, I like that. What do we think, guys? Pronunciation? Everyone. Any errors with words? Oksana?
Good.
Nana? I think he's gone actually. Selena? Good?
It's
Good, I think.
okay. Yes, good.
Fluency? Probably good, but again, she stopped here, didn't she? She stopped there. Why did you stop? Don't stop. Everyone.
Okay.
The problem with that is,
And
okay,
one thing,
she
sorry.
wait one second. She was, guys, she was waiting for me to say yes.
Mm,
Something. Don't wait. Why? Why do I say this? Because you don't really know what they're going to say. And if you leave spaces, it can be a little bit awkward sometimes. Do you know what that means, guys? Awkward. Awkward. Like some nurses are like this. Let's have an example. Example. Okay. Oksana, can you be my patient?
Yes. Yes.
Listen to this, guys. 3, 2, 1. Hello.
What's happened with you, doctor?
Oh, I'm waiting. I'm waiting for you to say hello.
Hello.
Was that good, guys?
No, it's not
Right?
good.
So don't wait in your exam. You don't know if they will reply. You don't want to start like crazy, start stopping in the middle. Just like this, guys. One more time. 3, 2, 1, go. Hello, my name is Alan. I'm one of your doctors for today. Could you please confirm your name and date of birth?
John Smith, 88.
Okay, can I call you John?
Yes, of course.
Great. Nice to meet you, John. I'm aware that you're having problems with your medication. So how are you feeling today?
Not very bad, not very good.
Okay, you see, guys, and then empathy. Fast, not stopping. It sounds very professional if you do it like this. You will sound more professional. Okay, now Laboni, guys, with the name, did Laboni get the name okay? I thought her grammar was good, but did she get the name? Everyone. I think there was a problem with the name. What happened?
My name is.
Did I give her my full name, guys? This is just a small thing. It doesn't really matter, but I
No,
only said
just
John.
saying John.
Now, Laboni, it was very good because then she said, "Oh, can I have
Thank you.
your age?" Right? That was
Okay.
good, Laboni. But
Thank you.
Laboni, you can say it like this, guys. Just say, if they don't give you everything here, just repeat. Say, "Oh, sorry. Could you please confirm your full name and date of birth?" Right? If they're not giving you the full name, you can just add in full. Okay, Laboni? So that was, I
Yeah.
think, a small problem with it, but apart from that, very, very nice. Okay, does anyone else want to try this? It's been really good. I think we should try
Yeah,
it. Go on.
I can try.
Again, yes, I was going to say the same idea
Yes.
because I think now you have had more time to read it. Okay, so let's listen again to Selena. 3, 2, 1, go.
Hello, I'm Selena and I'm your doctor today. Could you please confirm your full name and date of birth, please?
Yes, it's John.
Can I call you John? Okay, can I call you John?
Yes, that's fine. Now, Selena, sorry, I'm being mean, but just repeat the question. So
Could
I
you
did
please
not
could
just say,
you
can I
please
have your
confirm your full name and date of birth?
exactly. Okay, one more time from the beginning. Ready? 3, 2, 1, go.
Hello, I'm Selena and I'm your doctor today. Could you please confirm your full name and date of birth?
John,
Your date of birth?
88. Oh, 20.
Thank you.
Okay, again, Selena, just repeat the sentence like this. Could I please confirm your full name and date of birth? Sorry. Could I please confirm your full name and date of birth?
Okay.
You're just gonna emphasize the
Yes.
word, okay? One more time. 3, 2, 1, go.
Hello, I'm Selena and I'm your doctor today. Could you please confirm your full name and date of birth?
Yes, it's John 88.
Thank you. Can I
Oh,
call?
this is not my full name, is it? It doesn't really matter. But listen, I didn't give you my full name, right? There could there
Yes.
could be there could be more
Okay.
than just repeat the phrase.
Could I please? Yes.
Okay, one more time. Let me give you an example. All right, you be my patient. Ready?
Hi. Okay.
And don't give me the full name. Just give me one name.
Okay. Okay. I understand now.
Three, two, one. I am the doctor. Hello, I'm Alan, and I'm your doctor for today. Could you please confirm your full name and date of birth?
John 88.
Sorry, could you please confirm your full name?
Johnny Smith and 20th of June 1988.
That's great. So, can I call you John?
Yes, please.
Okay, great. And we should put age here, shouldn't we? Okay, so get the idea?
Yes.
Okay, so now you. 3, 2, 1, go.
Hello, I'm Selena and I'm a doctor today. Could you please confirm your full name and date of birth?
It's John.
Could I please confirm your full name and date of birth?
Oh, sorry. John Smith, and it's June the 1st, 1974.
Thank you. Okay, can I call John?
Yes, that's fine.
Okay, nice to meet you. I'm aware that you are having problem with medication. So how are you today?
Oh, I'm feeling really bad with the medication. It's really making me upset.
Oh, sorry to hear that.
Okay, that was really good. I thought that was really good. Okay.
Yeah.
Now, guys, of course, this can change, right? This can be anything here. You are having problems with I don't know, children, not you're having problems with
Shoulder pain or something.
children, yeah, in pain, okay?
Yes.
We can change this, guys. Who wants to try it now with children in pain? You need to change this. Who wants to try? Oksana, you want to try this one?
Yes.
Three.
For example, I wear that my children have pain.
Okay, but you are the doctor, so you're going to start from here, but you need to say
Okay.
change this one, okay? Change this. 3, 2, 1, go.
Hello, I am a doctor. Sorry. Hello, I am Oksana. I am your doctor for today. Could you please confirm full name and the age?
Yes, it's John.
Sorry, full name and the age, please.
Oh, sorry. It's John Smith and 88.
Okay. Can I call you John?
Yes, that's fine.
Great. Nice to meet you. I am aware that
Go on. He's
you
88, but he has children, okay? He's 88, but I have children.
yes, it's confused. Yeah, maybe your children have pain. So how he feeling today?
Right. Guys, this is coming from the cue card, right? So whatever is in the cue card, you put here, right? If you know already. It could be children in pain, it could be it can be anything, but it's from the OET cue card. So I'm aware that you have a rash. How are you feeling today? Like that. Okay. One more time from the beginning. 3, 2, 1, go.
Hello, I am Oksana, and I am your doctor for today. Could you please confirm your full name and age?
Yes, it's John Smith, 88.
Okay, can I call you John?
That's fine, yeah.
Great, nice to meet you. I'm aware that you have rash and pain.
Yeah,
So how are you feeling today?
I'm actually feeling really good. It's everything has got, the medication is working really well. I'm feeling very happy.
Okay, I'm glad to hear that.
Yeah. Guys, what did she just say there?
Because you don't have a lot of problem, you're happy. You are happy.
Yeah, guys, we can say glad. I'm glad to hear that. I'm sorry to hear that. I'm glad. Don't forget am though. You didn't say am. Okay. So guys, this can be positive or negative. I'm glad. I'm happy to hear that. I'm sorry to hear that. You can change it. All right. Now, this is like just a demo class. I was waiting for someone to ask me this, but no one has asked me yet this question. Do I know the patient here or not in this situation? Everyone, do I know the patient?
Yeah, you need to ask my sound clear or good, or you understand me?
No, that's not what I mean. Nice comment, but that's not my point. Guys, if I am introducing myself like this, is it a known patient or is it an unknown patient?
Unknown patient.
Unknown patient.
This would be an unknown person, right? If
Yeah.
you know them, if you met them yesterday, right? If the situation is that in the morning you already said hello, in OET you can have many different situations. Okay, so you've got to have a known introduction and an an unknown introduction and a known introduction. So if I know them already, am I going to do all of these things? If I know them already?
No.
No.
So let's think about what we would do if we knew them, right? Will I say hello? Will I greet?
Yes.
Yes. Will I say my name or will I say the patient name?
Patient name.
Yeah. So in this case, you would basically say, hello, John. You just
How are
immediately,
you?
Nice
yeah,
to see you again.
Yeah, I like to say, in my opinion, it's nice to say, nice to see you again. That's in my view, that's okay. So greeting, patient name, and then say something nice. Nice to see you again. All right, show some positive empathy. Do I need to check their name, guys?
I don't think so. It's
I think you don't. Some people like to do like this. They'll say, oh, what's the phrase like? I know we've met before, but I just need to check your name or something like that. Some people like to do it anyway, but I really think if you know them already, if it says in the cue card that you spoke to them yesterday, you don't need to check the name, okay? If you're not sure, Selena, if you're not sure, just use the unknown. If you don't know, then do unknown, okay? Situation, I'm aware that. Do I need to say this? Is this good thing? Yeah, that's good, right, guys? Definitely good.
yes,
Shall I ask them how they feel?
yes,
Yeah. Shall I show some empathy when they say something good or bad?
yeah,
Okay. So this is your sort of known patient. This is your unknown patient. And this introduction will usually work in most situations. For a home visit, you can change your situation phrase. Does anyone know the phrase we can use for a home visit? This is really all we need. What is the home visit phrase? Anyone? If you are going to the home visit. No one, any ideas at all in a situation? You can say, I'm aware that. It's not actually bad in a home visit. But does anyone, come on, can anyone think of a better phrase? I am here.
I'm here to visit you.
Yeah, well, I'm here today to,
To
you can give the reason, right? In a home visit, guys, give the reason. Like, I'm here today to check your blood pressure. I'm here today to speak to you about your problems with mobility. I'm here today to prepare you for surgery. Okay? So this is home visit. It can be here or it can be here as well. Home visit. Okay, I'm going to finish this class, guys, because this is just a demo class. Thank you so much for helping me today. I really appreciate it, all of you. Take a photo of this, okay, and just practice yourself. Just memorize it, repeat, repeat, repeat. It's very, very easy when you just practice a few times, okay?
Thank you so much.
You are welcome. So take a photo.
thank you so much. Thank you.
And let me just finish by saying the best students in OET, the ones that do the best in the exam, those are the ones that review a lot. Okay? So repeating things, reviewing things, that is the secret, I think, to studying in general. You don't have to learn lots and lots and lots of new things, but you have to learn some things and then repeat them. Learn them very well. Okay? My name is Alan from SET. If you want to chat to me, guys, about the school, or if you want to ask a question about the school, you can ask me now. Would anyone like to ask me a question about the school now? We are SET English and we do 4 hours of live classes like this every day. If you would like to have 4 hours of live classes, or if you would like to discuss that, because we do many things actually, not just classes, we do mock tests, we do one-to-one, we do, what else do we do? Writing, you can send letters. Can everyone see this here?
Yes. Do you taking class on weekend?
I'm afraid that's the one thing we don't do.
Is
Yeah,
it Monday to Friday?
it's Monday to Friday. Yes, we can be flexible with lots of things, but there's not a lot of weekend classes. I think we have one teacher. She sometimes does the weekends,
Saturday in
but usually
on
it's
Saturday.
it's quite hard to
Okay.
find teachers who want to work on the weekends.
Okay.
Which I know doctors and nurses work on the weekends all the time. So yeah, but why don't you send me a message? Who was
Okay.
that? Was that Selena?
Yeah.
Send me a message anyway, Selena. I'll tell you what options we do have for weekends.
Okay, I will. Thank you.
Guys, thank you. Have a lovely day. I really appreciate your time. Take care.
You
I'll see
too. Thank you.
Lovely day, guys.